Hi, my name is Dr. Erin Denil with Rejuvenate Life Chiropractic. If you like my videos, go ahead and like, subscribe, and share the YouTube channel as well as any Facebook post. Today I'm going to talk about low back pain. I get a lot of people who ask me about how do I deal with low back pain, especially like right when they're in the middle of an acute or recent injury. It becomes a big deal. Some of the things that I like to do are just making sure that anything pretty much from the torso, the whole torso, okay, this general area in here, the core as it's known, we want to make sure that we're strengthening that as well as stretching anything that would get tight. So when someone is in massive amounts of pain, the first thing I like to do is just start with something simple. If somebody can get on a big exercise ball and just simply lightly bounce on that ball, that helps the cerebral spinal fluid flow if they're bouncing on that ball. So we like to get some of that flowing, just because anytime you have motion inside the body and get fluids and oxygen and everything, it just is fantastic. The next thing is going to be either a cat-cow type pose from yoga or like a Mackenzie extension exercise. So in the Mackenzie extension exercise, pardon the hands, I photograph myself, right? I do my own video. You're just going to be leaning back, okay, gently, to put the body into extension. This is one great exercise. Cat-cow, there's a couple versions of cat-cow. So it's on all fours, about shoulder width apart for your hands and your knees. I'm just doing it on a soft surface. The full pose would look like this for cow and the arch for cat. When we are hurting, for one, it's really hard to just get into this position to begin with, but it is tiny micro movements just of the pelvis alone, a drop and a lift. Small, teeny tiny motions, whatever the person can handle, just getting extra blood flow to the area. The disc gets more water because of the movement. It will attract water molecules with motion. You can then start a little bit bigger. Is a great one. A stretch. I like more of a child's type pose in yoga. However, with doing this, come down to where it's a good comfortable stretch. If you can go all the way down, great. If you can take one hand and cross it over the other one and get a stretch in the side while you're down there, that's an option. So stretch over, make sure you do it both sides. Another good one is a hip flexor stretch, because this gets tight. So a hip flexor is anything that helps us do this motion. Okay, you can do this with a knee down, in which you're leaning forward. I like to tuck the pelvis first, and you're just leaning in, and you can feel the stretch through here. Or you can do this where you actually would lift off. I'm not going to, just because I'm on an unstable surface. You tuck, and you can even lean back. You want to add more to that stretch, then you would simply take your arm on the same side and lean it over to the other side. So your arm position on that one would look like this. Okay. So stretching the hip flexors is fantastic. For strengthening the lower back, we want to do like a Superman position. We can do a couple of other simple activities. So if you're in the all fours, then you would be extending the opposite arm and the opposite leg out, thumb up, and balance. You want to try to keep your back flat like you're trying to balance something on a tabletop. This one is fantastic, and you can hold 3 to 5 seconds, and you switch opposite arm and opposite leg. Other one is just simply on your back. We can just start with a simple pelvic tilt and tuck, firing off the glutes and back down. Again, contracting. If this is too hard, Then we can start by just pulling our belly button in towards our spine and release. 3 to 5 second hold and release. Okay, so you can start with the belly button, then you pull your belly button down, tuck and release. Tuck and release. Another good one would be to be lifting up with a little bit more glute squeeze. You can start touching opposite arm and opposite leg. Okay, if you're more advanced, you can do it as more of an ab exercise, right? You could get into like a full bicycle to strengthen. You could have a big exercise ball and you could put the ball down and up. You could touch opposite arm and opposite leg for strength. The Supermans, if you are down on a table, you just extend opposite arm and opposite foot. Okay, opposite arm and opposite foot while keeping the pelvis neutral position. So this is another really good one for the low back. And I'm just trying to think if I forgot any that I wanted to show you. Plank. Plank is a good one. So if you want to do plank just on your knees, you're going to have your arms about shoulder width apart. You're still going to go into a plank position. Your knees are going to be down, okay? Flat back, and you're just holding. If you advance, then you stand up on your toes to do it, and you just hold. If this is too much, you can always drop down and hold on your elbows instead to lift up. You want it to be more advanced after you improve. You can stay in that lower position. You could start learning to lift up and going to the sides if you don't break things in your office, but you can do those again side to side on a plank position just to get some of that rotation motion. If you've just had a fresh disc injury, I do not recommend any of the twisting, positions. Simply leaning back and holding. You can do this with your leg, one leg up, both legs up, and hold. You can do straight legs out. When you get a little more advanced, you can start adding some twisting motions with legs down or up. This again strengthens the core. So a good back exercise. I like to do a lot of the shoulder exercises as well for the back because it's all part of that core back. So I have another video out there in which we're lying down and we are just doing certain motions with our arms, in which we'd be lifting up out to the like 60 degree angle, T angle, 30 degrees. Okay, so 30, 90, 120, 170. As far as angles go, you can hold weights, not hold weights. If you want to make it more challenging, you could squeeze your glutes, fire up your low back, and release in between each one, firing up your glutes and releasing. So those are some of my favorite stretches, as well as my favorite exercises for some core work for people who are having chronic low back pain. In my office, I do a combination of, depending on what people need, I have a cold laser therapy machine that I use. I have tools that help me break up scar tissue. I have drop table. I have instruments that I adjust with. So I pretty much do a wide variety of things. I have a myofascial release instrument that works fantastic. All of it is combined in part of the joint. So we need to really work on the whole joint when we do things. But some of these things you can do at home, which are great. And I like to just have the video available so that you can kind of see some of those progressions. Again, I'm Dr. Erin Denil with Rejuvenate Life Chiropractic, and I hope you have a fantastic rest of your day.